Isoquants are what we're using to depict the combination of inputs that can produce whatever our output is. So since we're thinking in healthcare terms, our output is usually caring for a patient, some health benefit. We're thinking from the viewpoint of the producer. So here we're explicitly thinking about something like a hospital, some kind of provider. So let's think about our first isoquant. I'm going to do one for a mental health care in which there is two possible inputs of prescriptions and therapy. So let's suppose this depicts my first isoquant where there's different possibilities for treating one patient. So let's suppose this point represents the option of using one prescription with 5 therapy visits. Now, every point on the isoquant is describing the same exact level of quality and patient outcome. So if this is on the same isoquant, let's suppose that is using the combination of only 1 therapy visit but 4 prescriptions. In this framework, this must yield the same amount of patients, 1, and the same level of quality, 1. If it does not, then they would not be on the same isoquant. So every combination on the isoquant just tells us about other options that are all equally effective. So the main concern with an isoquant is what is possible technically in order to produce. It does not tell us what is the best. It does not tell us anything about what these inputs cost. It just tells us about what inputs, if they were put together, would end up working to care for this patient. So this is something that will need to be combined with additional information in order to decide what is the best. So not what is best, only what is possible. Another characteristic of the isoquant is that a higher level isoquant describes more output. So let's say this is 2 patients. So if we're going from here to here, we can use more resources to help more patients. Now, to use more resources, we still have a lot of choices. Let's say, for example, we started at point D. This means we could jump up here to serve more patients, and that didn't involve more prescriptions, just more therapy. But jumping to any point on that isoquant is a way of helping 2 patients. So we can see here that a higher isoquant means more output, but we still have the choices of potentially shifting how many prescriptions and how much therapy if we so chose. So higher isoquants are more output, as well as in our case there's nothing smaller than 1 patient, but moving the other direction would mean less output. So a full series of isoquants that don't cross each other anywhere, they're parallel at each point in order that they don't cross, that they involved higher and higher levels of output to the right as increasing and lower to the left.